This segment is sponsored by Mercy Health. If you or someone close to you has recently been diagnosed with cancer, you know it can be devastating. In addition to the emotional shock, understanding treatment options can be daunting. The bottom line is you want the best care as quickly as possible using the latest technology. Dr. Nina Johnson is medical director at Mercy Health Johnson Family Cancer Center, and she is here to talk about some of the technology options available to the community. Hi, Dr. Johnson.
Hi, thank you for having me. So
Glad
as you
to.
know, if you need radiation treatment, Mercy Health, the Johnson Family Cancer Center, continues to invest in top-notch technology. We've recently added a new Varian TrueBeam linear accelerator and upgraded our current one so that we will have state-of-the-art radiation treatment right here in Muskegon.
So I think it's something called a linear accelerator, and the terminology doesn't matter as much as what it does. What are the benefits of this new technology?
Well, this new variant technology allows us to deliver prescribed treatment with greater precision and speed, adding to our patients' comfort as time on the treatment table is reduced. We will reduce treatment time by 20% due to faster beam shaping, gantry rotation, and enhanced treatment imaging. Some of the new upgrades on this machine include something called iterative cone beam CT, which means that basically our imaging is better. So we need to see what we're treating. So the imaging will be better so we know that we're on the right spot. Another thing is something called 4D rapid arc treatment, which allows us to only treat when the target is in the patient's point of, say, respiration. So if the patients are, breathing and moving internally, and so when the target goes out of the field of treatment, the machine stops and turns back on when it's in the treatment field. So not only does it make the treatment more precise, but we don't have to treat a larger area in order to make sure we encompass the target. We can make sure we spare normal tissue and treat the target.
Not traditionally the way things have gone for patients. So faster and more precise. That sounds good. So what types of cancers can you treat with this radiation?
We treat pretty much all types of cancer. The most common ones are breast, lung, and prostate, which are the most common cancers that are around. But we treat brains, gynecological tumors, colorectal, pancreas, esophagus, skin, pretty much almost every type of cancer. There is an indication for radiation.
Now, I know that you pair this with other radiation oncology treatments. Tell me a little bit about some of the other options that are available at Johnson.
We always have utilized the state-of-the-art top-notch technology, which includes image modulated radiation treatment, image guided radiation treatment, rapid arc treatment. And then we do optical surface monitoring system. And that's kind of, patients like to know, we use this a lot for breast cancer. So the camera watches the patient while they're being treated in a breath hold to decrease the heart dose. So we watch them breathe and the beam turns off when they fall out of the breath hold. So that decreases the dose to the heart. And we've done that for several years, and we'll continue to do that. We also do stereotactic body and brain radiation treatment and high dose brachytherapy.
The bottom line is that patients who present at Johnson Family Cancer Center can feel confident knowing that you have an array of tools and the very latest in technology in treating them.
Yes, our community is very fortunate that we have state-of-the-art treatment so close to home. But to receive the full benefit, you definitely need the staff to utilize the technology and to implement it. So we do have great staff here that has been able to implement all of the latest technology that is available.
Well, that is terrific news. To learn more about specialized radiation technology and cancer care at Mercy Health, visit their website. You can find a link at 13onyourside.com. Dr. Johnson, thanks so much.
Thank you for having me.